Welcome to our YouTube video series here at Buckingham Center, where we go through a couple of different procedures that we offer and hope to answer all of your questions. In this video, I'm going to talk about cosmetic rhinoplasty. So what is a rhinoplasty? A rhinoplasty means to change the shape of the nose. Concerns that we see in patients are patients that have a little bit of a hump on their nose. Maybe their nose is a little bit not straight, or they're concerned about the way the tip of their nose looks. There are several different ways to perform a rhinoplasty, the main ones being through an open or a closed approach. The majority of rhinoplasties that we perform in our office are through an open approach. Through an open approach, we expose all the different aspects of the nose and then make the necessary changes in order to help achieve your goals. We do this to achieve your cosmetic goals while also maintaining the functionality of the nose, ensuring that your breathing is great both before and after surgery. Once we've exposed the underlying structures of the nose, what we're looking at is the lower lateral cartilages, the upper lateral cartilages, which is the middle third of the nose, and the nasal bones. Each aspect of the different thirds of the nose can be altered, changed, adjusted to help us achieve those cosmetic goals that we're shooting for. Oftentimes we'll harvest a little piece of septum, utilizing the resilience of that cartilage that's there to help bolster your long-term results. When you come in for your initial consultation, we'll take several photos that will then be morphed into a three-dimensional rendering of your face and nose. Once the images have been morphed, we use them as a tool to go through and make the tiny adjustments that we plan on making to your nose in the surgery. We make tiny adjustments to the imaging that we feel we can replicate in surgery, and this gives you a realistic expectation of what you can expect, although results may vary from person to person. Along with first-time or primary rhinoplasties, we also offer revision rhinoplasties in our office. A revision rhinoplasty means that the patient has had a previous surgical procedure on their nose to alter the shape or function. Revision rhinoplasties can be very complex procedures, depending on how much surgery was performed the first time, so choosing the right surgeon is very important. Once we've confirmed your candidacy for rhinoplasty, the next step is to schedule your preoperative appointment. You'll be greeted by your surgical coordinator, who will bring you into one of our consult rooms and help guide you through each step of the process. After meeting with your surgical coordinator, one of the nursing staff will come in to help go over everything preoperative with you that you need to know. This includes medications, what to take and what not to take prior to surgery, as well as postoperative care. We'll also schedule all your postoperative visits at this point. After you've had the chance to talk with your nurse about all the questions you may have, you'll meet with your surgeon, who will then go through the process again with you and make sure to answer all your questions that you may have. Now you've made it to your surgical day. Once you arrive at Buckingham Center, we'll bring you back to one of our preoperative rooms where the nurses will greet you, answer any questions that you may have. Typically for rhinoplasties, we then start an IV, and then you will meet with both your surgeon and our anesthesiologist. We work with an awesome group of anesthesiologists who we've selected to come in and help take care of our patients here at Buckingham Center. After your rhinoplasty surgery, which may take several hours, you are then taken to the postoperative care unit, where the same nurse that has been taking care of you since you first arrived at Buckingham Center will see you through your recovery. The majority of patients will have a cast on the outside of their nose and some stitches along the incision line on the inferior aspect of the nose. We'll see you at your 1-week visit to remove both the cast and the stitches. After your 1-week appointment, where we remove your cast and your stitches, we'll then talk to you about getting back into your normal physical activity. You may notice that your breathing is still a little bit challenged because of all the swelling. However, this should get significantly better after the 2nd week. Depending on if we manipulate the nasal bones or the dorsum of your nose, we may ask that you not wear glasses or sunglasses for up to 6 weeks after surgery. You will also likely have some stitches on the inside of your nose that will dissolve after the first several weeks. The biggest social downtime that may be associated with a rhinoplasty is likely the bruising. This can sometimes occur underneath the cheeks, although we have different techniques to make sure that this is as minimal as possible. I like to tell patients 2 to 3 weeks for a social recovery. At this point, your nose will still be swollen, but everybody else shouldn't know that you've had anything done. Swelling in your nose will continue to improve with time. I like to tell my patients it's like gravity. The top of the nose will get a little bit better before the bottom of the nose. It may not be something that other people notice, But if you take photos at 6 weeks, 3 months, and 1 year, you may see tiny little highlight changes that just help enhance the results of your rhinoplasty. I typically take my postoperative photos at 3 months and then oftentimes at 1 year, kind of depending on what your schedule is and your availability to come back and see us again. Thank you for taking the time to learn a little bit more about Buckingham Center and the procedures that we offer. If you have any other questions, please feel free to reach out. We'll look forward to seeing you soon.